Others can help you during life's trials, and you will help others during theirs. Be careful how you ask for help after a trial or trauma. Often when we experience a trial in life, society tells us to suck it up. It will get better with time. Why do some people give you the cold shoulder when you are at your lowest point? I think some just don't know what to do or say. This video will help you develop that list of helpful others without adding more stress to your current situation. Who can help you find post-traumatic growth after life's trials? Which friends are expert companions and which ones will struggle to know how to help you in your time of need? Which support groups or professionals can help? When people come to me for help, I use this lesson I call Tap Your Helpful Others. This video introduces you to a third of my trial action paths or TAPs I explain in my books and videos. Do people unintentionally tell you to suck it up? It happens all the time. This actually happened to me after my brother's suicide. If you or others feel you are not managing to deal with it, you may consider seeking a therapist. Although not all trials you face will necessitate you seeing a doctor or therapist, I do believe there are times when you will need one or both. You are not helpless in your search for the right providers, and once you find them, you will need to do more than just listen to their advice. You will have to do the homework, such as journaling or taking medications. The right helpers can be invaluable in your success. Be selective in your choice. Some doctors and therapists might only focus on your symptoms, and some may be actually practicing on you. This is not medical advice or therapy, but educational tips. Consult your doctor and therapist before using any of the things I teach here. If we're just meeting for the first time, I'm Hugh Watt, author and founder of Trial Tappers. Who are Trial Tappers? People that find hope, resilience, and post-traumatic growth after life's trials and traumas. Our motto is, we tap pain, we find a path, and we grow stronger. The image here is a tapped maple tree with sap dripping out. A pair of hands is holding a galvanized metal bucket like this one here against the maple tree. And under the metal tap, like this one here, to collect the dripping sap. I use these props and images when working with clients who are experiencing trials in life. Farmers often need help harvesting syrup, and you may need help overcoming your trial. I use a brainstorming technique such as these and others to identify people around them who are willing to help. These might be friends from the past, current family or friends, or even people in their community they don't know well. I try to help them identify 3 friends, plus 1 therapist, 1 spiritual guide, and people such as volunteers and first responders. The key is for you to make a list of your own. My guess is that you will fail to list some important people. When I was looking for my therapist, I didn't just accept the first therapist that took my insurance or that was accepting patients. I looked them up online. I reviewed their credentials. I asked them questions and interviewed them by phone, text, and email. I asked very specific questions. How long have they been in practice? How many clients have they worked with my specific problem or background? What was their gender? Now you may ask why gender makes a difference. Some victims of abuse don't want a therapist who is the same gender of their abuser. In other words, does your therapist understand the physical, social, and emotional impact of trauma on the individual? What approach do they use to treat trauma? Sometimes, your first attempt at finding a therapist may not work out because you may feel more comfortable with a therapist of a specific gender, age, or religious background. Finding a good therapist can help you overcome your trials and especially traumas, but you should feel comfortable asking for specific plans to achieve your goals. How will you know if you need to see a professional? If you have one very specific trauma or trial, the need for a professional might seem obvious. Other times, trials just build up and overwhelm us. Again, not everyone will need to see a professional for every trial, but if you're having some of these reactions or responses, it's something you should consider. For example, if you have been experiencing the following reactions for more than a month: anxiety, anger, daydreaming, nightmares, changing in eating habits, excessive alcohol intake, risk-taking, difficulty making decisions, high level of fear, diminished hygiene, self-medicating, violence, depression, panic attacks, guilt, hallucinations, and or trouble sleeping. This is not an exhaustive list of every possible indicator that you might need help, but you get the idea. Now, to be absolutely clear, if you're having feelings of helplessness or hopelessness, extreme guilt, and suicidal thoughts for any amount of time, you need help immediately. Call 911. As a trial tapper, you are more aware of the growth opportunities professionals can bring and choose this path when needed. Finding helpful others, otherwise known as expert companions, will take a little bit of effort, but I encourage you to not give up. If you feel you have no positive friends in your life, then you may need to develop positive friends by reconnecting with former high school classmates, taking up a new hobby, or attending a religious group. Sometimes finding helpful others is not enough, and you will need to increase your spiritual or existential connections. If this is the case, you're going to want to watch my next video called Unseen Power. If you want my audiobook, sign up for Audible's free link trial below. Hit that like and subscribe button so you get notifications of future videos. Share with someone that might benefit from this information. I hope you apply these skills and become a trial tapper. Again, our motto is, we tap pain, we find a path, and we grow stronger. See you next time.